On this screen, the function menu with the buttons Assessment, Disorder Process and Differential Question Process is displayed below the header, and the assessment area for documentation of the patient's signs and symptoms is shown. However, if you use the app for research purposes without a specific patient, the assessment area will not be displayed. On the far right of the function menu, you will find a Notes icon, which you can use to call up a pop-up to make personal notes. If you use this function regularly and systematically, your personal wealth of knowledge and experience will be documented over time. When the assessment area is visible, the assessment button in the function menu is highlighted. By clicking on the assessment menu button, we can switch the assessment area off and on again. The various categories of the assessment are initially listed under headings. Using the arrow down symbol, each category can be expanded and edited in detail. If you open the basic data category, you can collect the general patient data. As soon as you make an entry in any field in the assessment area, the font in the category title changes to red or green and the background turns white. When you return to the assessment later, you will recognize that there is documented information in this category. You can close a category with the up arrow icon. Only the main complaint field remains permanently open. In this field, you document the main complaint of a patient. For example, spasmodic cough, acute, with difficult expectoration, some pain on coughing. The so-called 5-star rating appears immediately. You can now ask the patient how she rates the severity of her main complaint on a scale of 1 to 5. 1 means very low intensity, 5 means very severe intensity of the symptoms. Make sure you use the 5-star rating. You can assess the effect of the treatment as it progresses and draw your own conclusions. Let's assume that the patient indicates the severity of her symptoms with 4 stars. As soon as we have given a star rating, further options open up with which we can determine and collect possible Chinese syndromes. Firstly, the Select Syndrome search field appears to the right of the input field. Here you can directly call up a Chinese diagnosis and add it to a list of possible syndromes. The patient's difficult expectoration indicates dryness. We therefore select lung dryness. The Add button appears. With this button, we can add the syndrome, lung dryness, to the list of possible syndromes. As soon as we click on it, the button changes to Added with a green background. The Analyze Syndromes button now also appears in the function menu. After a detailed assessment, we can click on this button and further analyze the collected and possible Chinese syndromes. When formulating a Chinese diagnosis, you can be supported by the so-called differential questions. You can call these up using the corresponding button. A list with the question categories opens. If you click on a category name, the corresponding questions will appear. You can ask the patient in more detail in order to arrive at a Chinese syndrome diagnosis. Secondly, you can use the Search for Syndromes button to open a search window and enter a symptom in the search field. You will get a list of combinations of key symptoms. If you select one of these combinations, the corresponding syndrome will be displayed. You can also add this syndrome to the list of possible syndromes by clicking on the Add button. And thirdly, you can use the differential questions process to guide you to a Chinese syndrome diagnosis. You call up this procedure in the function menu with the differential question process button. In the same way, you can record and document further symptoms and findings and collect the relevant Chinese syndromes. There are 3 additional input fields for complaints as well as input fields for tongue and pulse findings. There are also input fields for the various disease and lifestyle categories. As soon as you have entered a symptom in an input field, the title changes to the font color red with a white background. When the category is closed, this indicates that an entry has been made here. After completing the assessment, you can continue working in 2 ways. Firstly, symptom-orientated, in which you call up the disorder process in the function menu, or secondly, syndrome-orientated, by opening the list of collected syndromes in the function menu with the Analyze Syndromes button and further editing this list.